how to manage early pregnancy symptoms and possibly cope with them. I know when a woman is pregnant, especially that first 3 months of their pregnancy, this early phase of pregnancy is usually hell for some women, because these are the times some of them have challenges in some pregnancy symptoms that will keep them down. But before I tell you how to cope or how to manage these symptoms, you need to know the normal and the abnormal symptom at this stage. In early pregnancy, there are some expected symptoms you will feel which we consider as a normal symptoms. For example, that usual nausea and vomiting, loss of appetite, tiredness, weakness. All these things may be normal in early period in pregnancy. But when we talk about the abnormal ones, we talk of excessive vomiting, which we call hyperemesis. You know, not all vomiting are normal during pregnancy. When yours is excessive, that throughout the day you can't tolerate anything, you vomit all throughout, you may be having this hyperemesis, which is an abnormal pregnancy symptom. So note this. Other ones like faintiness, like all of a sudden you lose consciousness, all these things are not normal signs. Or you may be seeing some blood discharge, they are abnormal pregnancy symptoms. But when we talk about normal ones, these are how to manage or cope with them. For instance, I will take it one after another. For instance, if you are having challenge with nausea and vomiting as a pregnant woman, you know, we call this morning sickness in pregnancy, probably because majority of the women have this symptom at the early hours of the day, maybe in the morning. Then in the afternoon or in the evening, some of them might get a relief. So if you are having nausea or vomiting during the early hours of the day in the morning, you can feel free to go through the stress of this challenge. But that point or that period of the day that you get a relief, try to grab the opportunity and eat what you can tolerate at this moment. If it is fluid, if it is food, you can take it one at a time, bit by bit. Don't go about trying to get filled all of a sudden. Try to take those meal, those water, those fluid bit by bit, okay? It will help you. Then when you get to the evening, if it is in the evening that you can get yourself or you get a relief from this symptom, try to take something at this period, so that any moment the symptom return again, you can allow it take its course, okay? Then if it is the time that you are having tiredness, you know, tiredness or weakness may come as a result of not being able to tolerate some things orally. You know, when you're having this challenge in pregnancy, the best way to manage this is to engage in some form of exercise. Don't go about lying down all the time or staying in one place. Move around or try some exercise move. This can help you improve or cope with this pregnancy symptom. Then if you are the type that have a case of tirelism or increased passing of a spit, you spit every small thing, you can't contain anything in your mouth, you even have a special container at this moment, best way to cope with this is to get something like an ice. You can be chewing an ice, or you can get an unsweetened popcorn, something that will keep your mouth busy, okay? Or you can go for a chewing gum or anything at all that once you put it in your mouth, it can keep your mouth busy. This is another way you can cope with excessive passing of spit during pregnancy. You know, all these things are normal pregnancy symptoms that when you feel them, you don't have to be scared something may be going wrong. It's just your body trying to adjust with the changes that take place during pregnancy. All right, don't forget, this is your favorite midwife, Joy aka Lady Ago, and if until now you have not subscribed to our YouTube channel, kindly do that, because I'll be giving you updates on what or ways you can go about with your pregnancy stages. Enjoy yourself and see you on our next video. Thank you.